Hi, my name is Dr. Anthony Lemaire and I'm a cardiothoracic surgeon. Today we're going to talk about mitral valve repair or replacement. Before we get started, however, I want to go over the anatomy of the heart. This is a model of the heart. I like to think of the heart in terms of sides. There's a right side, which involves the right atrium and right ventricle, and there's a left side, which involves the left atrium and left ventricle. Blood will classically go from the left atrium to the left ventricle. And in between the left atrium and left ventricle is a valve. It's referred to as the mitral valve. When the valve opens, the blood goes from the left atrium to the left ventricle, and when the valve closes, the blood will stay in each compartment. Once the blood's in the left ventricle will squeeze and push blood to the ascending aorta. The aorta is the largest blood vessel in the body. It carries blood to the brain through these vessels. It goes behind the heart and supplies other organs, the kidney, the liver, etc. Now, if there's a problem with the valve, we'll have to either repair the valve or replace it. Before we do either or, we'll get the patient to the operating room, we'll then get on the heart-lung machine, and then we'll get into the left atrium. There are multiple ways to get into the left atrium. The most common way, however, is to go between the left atrium and the left atrium and the right atrium through what's referred to as Sondergaard's groove. Once we're in the groove, we get into the left atrium, and then we assess our valve. If we're repairing a valve, that essentially means we're fixing the valve. And we can fix the valve with placing sutures, placing a ring, or a combination of the both. When we're replacing a valve, we're taking a portion of the valve away, and we're putting in a new valve. That new valve can be a tissue valve, usually from another animal, or it could be a mechanical valve that will last forever. The tissue valves classically last somewhere between 10 and 15 years, but that can vary. Once the valve is either repaired or replaced, we close the left atrium, and then we work on getting the patient off the heart-lung machine. These operations classically last somewhere between 3 and 4 hours, but that can vary if you're adding if there are additional portions of the procedure to do. Classically, patients are stay 5 or 6 days in the hospital afterwards. Now, even though we do this operation all the time, there are risks involved. There's risk of infection, there's risk of bleeding, there's even a risk of death. All of this varies based on risk factors. Okay, if you have any additional questions, please let me know. Thank you very much.